The following education video will cover the ED Triage Note, or the Emergency Department Patient Care Record. One note will be used per patient per visit. Access to the note. You will highlight your patient and click on the Enter Document icon. You do have the ability to flip back and forth between your status board and the Patient List tab. Once the search bar comes up, enter Triage Note and double-click on this. From your status board, you will simply highlight your patient, right-click, and from the menu of options, choose Quick Launch Documents and Emergency Department Patient Care Record. We will now talk about the functionality of the note and your triage assessment. The note will be date and time stamped at the top. You'll be able to use the Copy Forward option to pull prior documentation into this note. Use their last visit, please. There is a triage time with an Insert Now button, which looks like a clock. Once you click on it, it will place the current time into that slot. You will notice that the area is blue, meaning this is a location within a note or just simply a placeholder. You will note under Mode of Arrival in the box that says Full Arrest, there are two circle buttons. We refer to these as radio buttons, and they are single select. If you need to delete that information, you will right-click and choose Delete Data. In the preferred language, you will note there are a series of square boxes. These are multi-select, meaning you can choose as many options as you'd like. Scrolling further down, you will get to the Chief Complaint and the Triage Chief Complaint. Please choose appropriately. Again, remember these are multi-select boxes. Simply uncheck your selection if it doesn't apply. Under the Triage Chief Complaint, once you make a selection and place a check mark in the box, a further menu will open for you to choose appropriately. Please check all that apply, and there is a comment field in the event you need to add more. Under the behavior disorder, once you choose yes, there are a series of symptoms that populate. Some of these will provide an alert and let you know to do a further screening or place a consult into the system. If you need to do a further assessment, you're going to simply click into the field right below. And you will note that next to these questions, there is a little icon with a blue square and a white asterisk, and these are what we call significant indicators, so they must be filled out in order to make your document complete. Continue to fill out any other information that is pertinent to the triage of this patient. You will note there is also a mental health assessment. It's either a yes or no option. If yes is chosen, you will then need to go actually backwards and choose from the behavioral assessment. You will enter the triage vital signs in this field by simply entering the numbers. You will note that there is a sepsis screen based on age. Once you choose the appropriate age and make a selection, the questions will populate. Once this menu opens, step 1 through 3 will be available to you to assess your patient appropriately. Based on your selection, you will have an alert that prompts you to either rescreen or follow up with the next step. Note that you will see a new icon, which is a red square with a white star. This is a mandatory field or a hard stop, so you must answer this question. From here, you will continue to move through the note and document any necessary information based on your patient's arrival and their triage state. Under General Assessment, you can do a head-to-toe. You'll be able to assess their pain appropriately. Note that you must make a selection before you have all available fields. Please make sure that you are assessing and documenting the pain in the appropriate pain scale. There will be an area for you to do your height and weight, as well as any visual. You may document a medical history. These are just the most common medical histories. There is a comment field that you may enter more information if necessary. Again, do note that the fields turn blue once you make a selection, and again, this is just to assist you with your location in the note. You will then move into your MedRec. There is not an area to document any doses or the frequency, but simply the medications the patient is taking. Please be as thorough as you possibly can, and do use the comment fields as needed. You do have an allergies link. Please use this to enter any new allergies and also verify that the allergies that are entered into the system are current and true. You also have an additional comments field for you to enter any narrative documentation that you feel is necessary to this patient's stay. Your triage level or category, please enter that. You will note the significant indicator. And any triage interventions, so what did you do with the patient? And then you also have an area for your triage glucose that you can document at any point. We will now go over the secondary assessment. This note again will be used once the triage nurse passes off report to the primary nurse. You will open up your note by accessing in the manner I showed you earlier. Scroll down from the table of contents and locate the secondary assessment. Once you click on it, it will populate to the top right of your screen. You will note there is a timestamp. Use the Insert Now button. And then you will move through this note again with your documentation of your assessment of the patient. Each body system will have a series of questions and available data entry points. Please note that your Glasgow Coma Scale are for specific patients only, so only fill in what you need to. We chart by exception. You may scroll through this note, or you can use your table of contents on the left-hand side and click into the topic in which you want to document, and it will pull to the right. You will have an abuse screen here. Please use this screen to appropriately assess your patient. If there is any suspected abuse of any kind, please go ahead and make a selection, and then there is a comment field for you to describe what the suspicion is. If this is also the case, you must put in for social work consult so they can follow up with the patient. You have a fall history and a social and family history where you can document drug, alcohol, or smoking status, as well as first-degree family health history. Any immunizations that you need to document against, the patient's private physician, and then you will go ahead and document your education assessment or your plan of care. Please identify the patient's learning needs, identified on admission, any barriers to that learning, how they learn best, and then any of our prevention measures. We will go ahead and save this note once you are through. The last time you access this note is upon disposition, so once the patient is ready to leave, please access your note again, locate disposition on the left-hand side. Once you click on it, it will pull the information to the right. From here, you will choose the appropriate disposition of the patient, whether they went home, they were admitted, they were transferred, or they expired. Each field will open up a different set of criteria you must document against. For the patient who is discharged, you will note that you have two mandatory fields, that red icon. Please enter your information. Please note the nursing final check. This is your last stop before you send your patient out the door. Make sure that you've completed all orders and anything necessary before the patient leaves. If your patient is admitted to the inpatient side, please click on Admit and enter all information here. So the time the patient left the department. When you're documenting who you gave report to, please use the first initial, last name, and their credentials. Any comments that you'd feel are necessary. And then, of course, your mandatory fields must be entered. For the mandatory field under outpatient medication review, This must be started before the patient goes to the floor, and we will speak about this a little bit more later. Under the admitted to, please enter the unit that the patient went to in the comments section. As far as the transport section at the bottom of your note, you may use this at any point that you transport the patient back and forth to a department or a unit. If your patient is being transferred outside the facility, please note all of the different data points that you need to document to. Please enter as much information as you can. And once you've completed this, you're going to hit save. In addition, if your patient expires, you will document to the fields that populate once you've made that selection, and you will follow up your remaining documentation on paper. Reviewing your documentation. The easiest way to review documentation is by highlighting your patient, choosing the Documents tab, making sure that under your display format that you have the correct format selected, and then you will note that your emergency department is a subheader, and you'll be able to see all the notes within there. You may double click on whichever desired note you'd like, and you'll be able to view this documentation much easier than accessing the note itself. Any further assessments or interventions not covered on this note will be in your ED flow sheet. Thank you so much for watching.